Good evening, everyone, and welcome to the NIIM monthly webinar. So we appreciate that it's a difficult time for everyone during the lockdowns across Australia. So great that you could join us tonight. But if you didn't make it, but you registered, then this will be available on our website. So don't worry, you can catch up later. And it's great that we've had almost 500 registrations. So a very important topic about boost your immunity and how to feel well both in and out of lockdown. And hopefully we will be out of that soon and much more connected with each other. So just a little bit about NIIM. NIIM has been around for around 20 years, and you're probably aware that we have quite a number of clinicians on site in Hawthorn and also on the Gold Coast. We also offer telehealth during the COVID pandemic. NIIM is a registered charity, and so there is an opportunity at the end if you would like to make a donation as part of us providing our health and education and promotion events, which we do as part of our charitable mission. So thank you again for joining us. Don't forget to join us on the socials in terms of Facebook, Instagram, and also LinkedIn. I'd just like to introduce our first speaker, Dr. Tamara Nation. Tamara is an integrative GP and runs her practice here at NIIM in Hawthorn. She has a long history of working with patients in a very holistic way, blending evidence-based therapies with complementary and traditional medicine. Her areas of expertise are women's health, children's health, chronic pain, and I guess more recently around the use of medicinal cannabis in those areas. So I'd like to introduce Dr. Tamara Nation, who her topic tonight is Boost Your Immunity, Vices or Virtues. Thank you, Tamara.
Thanks, Amanda, for the warm welcome. And I'm really excited and happy to be presenting to you this evening on such an important topic and in a time when it's been a real challenge. So tonight I'm going to talk about how we can feel better in and out of lockdown, how we can help our immune system to function at its best. And I'd like to kick off this evening's talk where I left off, I think, last year when I had a similar discussion around COVID-19 and being in and out of lockdown. So the image that I'm putting up is the different zones when we do face lockdown and when we do go in and out of the COVID-19 pandemic and how it affects us in our everyday life, because this is very relevant to our wellness and our well-being. So last year, we very much were in the fear zone when the pandemic struck. We saw supermarket aisles void of toilet paper, void of all those necessary tin goods or dry goods. People were also seen to be arguing, less tolerant, getting angry really easily. But as we've grown more and more used to being in a state of lockdown from time to time, a lot of us have moved from that fear zone into the learning zone, where we realize that we need to give up certain controls of things that we previously took for granted, that we need to stop compulsively consuming news and troublesome articles that add to our anxiety and our distress. We can identify our emotions, and we're becoming aware of the situation and our responses in the situation and evaluating critically the evidence in front of us. And the recognition that we're all trying to do our best and being tolerant of one another. And then the final zone, which is perhaps the most important zone, the area where we can grow from this situation of being in a pandemic, thinking about others and seeing what we can do to help people who may be worse off than us at a particular point in time, using the talents and capabilities that we have and sharing them, living each day in the moment, because often we don't know what's going to happen in a week's time, in a month's time regarding our lockdown situation, and being empathetic, not only with others, but also being empathetic with ourselves and kind to ourselves, trying to be emotionally stable and adapting to the changes in the best way that we can. So exhibiting patience, trying to be creative, and valuing the relationships that we have in a way that we can. So I'd now like to move on with regards to the definition of wellness. The Global Wellness Institute defines it as the active pursuit of activities, choices, and lifestyles that lead to a state of holistic health. What I really like about this definition is the word active pursuit. It really means that wellness is something that we're working on, that we're being proactive about in our choices, in our actions, trying to achieve an optimal or better state of well-being. So defining wellness is very much linked to holistic health, and this extends beyond the physical. Immunity and wellness are closely interrelated. It's really up to an individual because each individual has their own idea and makes their own choices and around behavior, around lifestyle. At the same time, it's also really influenced by our environment, and we can see that today being in and out of lockdown. The social, the cultural environment that we're in is far different to what it was 5 years ago at this time. So let's look at it, because wellness and immunity and understanding how these relate to one another and what they actually mean is really pertinent in understanding how we could be disrupted. So our physical health is, exercise, nutrition, sleep, mental health. That's around our cognitive function, our creativity, our executive function around problem solving, emotions, being aware of them, our spirituality. Certainly studies show that people who have a spiritual sense, an idea about their spirituality do a lot better, especially in times of need and tragedy. Social, so that's our interactions with people around us, our communities. And for a lot of people who do contribute to the community, the loss of this has been significant and has really affected wellness. And then environment. So a healthy physical environment, free from hazards, free from danger. And our environment right now has changed because it is one where it is hazardous. The risk of catching COVID is real, especially in Victoria. And we need to also at the same time be cognizant of our natural environment and how we can respect it. But right now, our environment has greatly changed. So I want to take a step back and look at what the data shows around the effects on wellness in and out of lockdown. So the effects on our immunity. What are the vices? What are the virtues? So this was a study published this year from Pakistan. It looked at the mental health of students. In particular, it looked at their sleeping patterns, and the finding was that they were significantly affected. There was an increased use in social media. There was the increase in the amount of time these young people were sleeping, a worsening of their sleep habits. They were sleeping much later into the evening, and they were also sleeping longer. They were in general tired, and they really struggled to figure out what day of the week it was. This led to a decline in their mental health during the period of lockdown. Another study done in North India, also looking at lockdown in patients who suffered from diabetes. The findings were that these individuals started to increase their carb consumption, increasing snacking and frequency. They had a reduction in their actual physical exercise, and 19% of patients gained weight who suffered diabetes. Now looking at Italy, what happened there? So this looks at a group of children who suffer from obesity. And the findings here were quite disturbing. There was an increase in consumption of potato chips, red meat, sugary drinks. The kids also spent less time playing sport. They increased in their amount of sleep, just like the Pakistani students. and their screen time also increased. Looking at what happened in a different group, and this is looking at New Zealand and the effects of lockdown in New Zealand. Interestingly, during lockdown, Kiwis reported an increase in trust in science, politicians, police, and there were higher levels of patriotism. But equally interestingly, their rates of mental distress during lockdown were far greater than the pre-lockdown pandemic group. Another study from a global perspective was done in the US, and this was done in California at a major trauma hospital. The findings were that there was less major trauma around car accidents, bicycle accidents, but importantly, there was an increase in falls, and the elderly population were more affected. There was also a 38.5% increase in suicides and a 20% increase in drug abuse and substance use. So these were certainly significant. Now let's look at what's happening in our own backyard. So what's the Australian perspective here? So I recently looked at the Australian Bureau of Statistics and the stats published. A really important finding was that Victoria, compared to the rest of Australia, had a significant higher state in terms of the quantity of people, 1/3 of Victorians suffering from depression and anxiety, compared to 18% for the rest of Australia. So clearly Victorians are suffering greatest in terms of their mental health. And looking at these stats in more detail, which populations are most affected? 1 in 4 women. So women are a group that are more affected during lockdown compared to men. 1 in 3 younger Australians, so those aged 18 to 34. And interestingly, you see that the age groups and the effect on mental health and psychological distress reduces with increasing age. So this is compared to only 10% of people aged over 35. The other one was people who already suffer from mental health conditions. So 48% of people who have known mental health issues are experiencing psychological distress during lockdown. And this is in comparison to 16% who do not have a known mental health condition, and 1 in 4 individuals who suffer from disability. So there's significant populations within our community that are having psychological distress during COVID-19 lockdown 2021. There was also another Australian study published looking at patients who suffer from type 2 diabetes. Quite a significant number reported negative effects in terms of their quality of life. And similar finding that younger people were more affected compared to older participants. Importantly here, 43% of these people studied who suffer from type 2 diabetes cancelled their healthcare appointments. And about 40% avoided making a new appointment despite thinking that there was something wrong with them. So clearly not presenting to a clinician or a healthcare provider will affect your immunity, will affect your well-being, will affect your health in general. So what are the issues? The issues of lockdown that we're facing around mental health, sleep disturbance, screen use, carb consumption, sedentary lifestyle, weight management, substance use, and not seeing a doctor. But sometimes by knowing the things that are a problem for us right now can help us change. And this is where we have to ask, how can we improve our wellness and our immune function? How can we make things better and target the areas where we know the weaknesses lie? So I'd now like to break this down into small bite-sized chunks. Firstly, around mental health. So we know that depression has an association with a reduction in immune function. So psychologically, simple things like reframing our thought processes, structuring our day, and creating something that we can look forward to maybe in the future. So giving us hope. They're simple techniques to improve our mental health. Dietary considerations include antioxidants, fatty acids, folic acid, B vitamins, vitamin D, polyphenols. And I'm really looking forward to Luis's talk on the gut, brain, and microbiome and brain axis, which is so relevant in this difficult time. Sleep. So sleep, as you can see from the studies, was disturbed, and there were issues around sleep. Sleep is really important for immune function. People who have disturbed sleep have an increased likelihood of falling sick to a virus. They also have increased time that they are sick. So it certainly affects our immune system. The relationship between cortisol and melatonin is really important. Reducing our metabolic activity while we sleep, having time to rest and rejuvenate. So what we can do to improve our sleep. So taking time to actually see the sunlight during the day, not staying indoors all day on Zoom, but seeing some sun when it's there. Reducing the time on the screen, avoiding sleeping during the day. There are dietary considerations, as I'm sure you're all well aware, around caffeine, alcohol, late night eating. Exercising and supplements and medications can also be used. And I heartily encourage you to make contact with your health practitioner if this is an issue. And screen time. How can we reduce this? Well, there are a few simple tips and tricks. Firstly, you need to know how much time you're on the screen for, so track it. Make modifications and set limits for yourself. Make certain places in the home no screen zones. So bedroom and bathroom are two obvious ones. Avoid the multitasking. It in fact reduces our efficiency instead of increasing it. And once you make these decisions, then stick to the routine and be disciplined. Carbohydrate consumption. So we all saw that increased during lockdown. And we know that high blood sugar levels, diabetes, definitely has an effect on our immune function, and it causes immunosuppression. So key things: proteins, non-starchy veg, healthy fats, and avoid snacking and have regular meal times. Physical exercise and activity. So studies have found that people who suffered from COVID and actually practiced regular physical activity had a reduction in the severity of their infection and a reduction in mortality. And this is because exercise itself can have pro and anti-inflammatory cytokine releases. It causes an increase in circulation, as well as helps immune function. So really making use of those 2 hours every day that we're allowed to exercise, I would highly recommend. So what can you do? When can you do it? And no matter how sedentary you might feel, just celebrate your success. Weight management. So we saw in the studies that weight does increase during COVID, multifactorial. So I've listed a few reasons: hormones, illness, diet, activity, stress. The key thing, it may not be the time to embark on, massive weight loss or weight management, but it is the time to at least try for weight maintenance. So checking your weight, making sure that you're stable, and if there is anything of concern, presenting to your doctor. Substance misuse. So in the US, we saw there was an increased rate of substance misuse presenting to the emergency department. And we all know that alcohol consumption can increase during lockdown. There's very little other activities for a lot of people to participate in, and it's sometimes an easy respite or release. So in terms of avoiding it, I think the key thing is to just recognize the signs when it is becoming harmful. So increasing quantities, cravings, withdrawal, psychological or physical dependence, and continuing use despite it causing potential harm. I've listed here some important hotlines that if it is affecting you, you might want to jot down or take a screenshot. And there's also lines for kids' helplines if kids are suffering from mental health issues, which is such an important part of what we're going through with lockdown. So here we have tonight presented many issues, but also many solutions. So I really want to empower you to move forward with confidence in steps that you can take. So prioritizing your wellness, recognizing where you are at right now and making those changes so that you can facilitate a healthy immune function, minimize your vices, and maximize your virtues. Thank you.
Thank you, Tamara. Thank you, Tamara. Lots of takeaway messages there, and I think a lot of us would be able to relate to, and a lot of people would be able to relate to those challenging behaviours that obviously impact on our physical and mental health, and certainly trying to shift our thinking to be much more positive and establishing the routines that staying at home seems to have really compromised for most of us is a great message. So thank you again for your continued regular guest speaking on our webinars. I'd like to turn now to Professor Luis Vitteta. Luis is the Director of Medical Research at MedLab Clinical and also a professor at the University of Sydney School of Medicine. He was previously Director and Professor of the Centre for Integrative Clinical and Molecular Medicine at the University of Queensland. His interests in research include microbiome, nutrition, probiotics, immune function, and medicinal cannabis. And tonight, Luis is going to speak on the topic of the gut, microbiota, and COVID-19. Thank you, Luis.
Thank you, Amanda. Let me just share my screen. Okay. Hello, everyone. It's good to be here to present at one of these NIIM webinars. First of all, I have a conflict of interest statement because I'm employed by MedLab Clinical Limited in a biotech company in Sydney, and I participate and lead its functional foods and cannabis-based medicines research programs, whether they be laboratory or clinically trial-based. Having said that, the overview for this presentation in the allocated time is to briefly look at the development of the human microbiome with particular emphasis on the intestinal microbiome, and look at perturbations of that intestinal microbiome as it relates to the differences between a destabilized system such as dysbiosis versus one that is in equilibrium, eubiosis, and then very simply look at immunological function and how that relates to aging in this very significant time of the gut microbiome in the time of COVID-19. Okay, well, first up, I think that the human microbiome in the 21st century, I think that we all understand that there is an interface of health and disease that is associated with the human microbiome, and that as we have progressed our understanding, there is now a connection between our microbiome and our human cells. When we think about what we are, who we are, we're actually about 43% of cells in our body, which is the human cells, eukaryotic cells, and that you might be thinking, should we be thinking about our DNA instead? And when you do that, we see that at the best, the contribution of the human genes is about 20,000 compared to about 2 to 20 million microbial genes. Now, researchers these days are very excited about systems medicine and systems biology, but when we look at the human contribution of about 1%, if one looks over these microbial gene input, it's pretty hard to do systems anything if one neglects to consider about 99% of the microbial gene input. So it's a significant contribution that we really need to understand. Now, medicine, if you look at this publication from the New England Journal of Medicine in 2002, it speaks very loudly as to medicine doing a fantastic job over a 50-year period in reducing some very serious infections. And if you look at the right side of the graph, you see that over that similar 50-year period, there has been a significant increase, almost completely opposite to the precipitous concentration of the incidence of infectious diseases with these autoimmune diseases that have shown up. And it wasn't until recently that the missing microbes theory of the hygiene hypothesis very much linked the possibility that we possibly have lost some of the bacteria that have been with us since millennia, that have led now to the loss of these activities in these bacterial genes that have now resulted in this significant increase in autoimmune diseases. So none of these diseases have been linked to the microbiome, but today, through association studies in humans and from animal experimentation, do show that these diseases can be caused by significant changes in microbial populations. Certainly, when we look at the ecosystem of bacteria in the human gut, it's a dynamic operation like any other human organ. The gut microbiota stability may be affected within the temporal framework. And in this context, bacteria turnover is a healthy feature expected in the gut. And in this schematic, we see the various factors that are associated from birth to, I guess, a toddler achieving metabolic and immune function equilibrium is very much the goal from birth to toddler. And proper consumption of nutritional foods such as breastfeeding will actually increase the benefit for that newborn to achieve immunological tolerance and metabolic equilibrium, which is significant because of the risks that are posed by early use of antibiotics, the negative interactions with host genetics and other environmental insults that can actually affect the baby and then delay or disrupt the achievement of metabolic and immune function equilibrium at the toddler stage, when now that child now has developed a full adult intestinal microbiome. And this example tends to show that there are bacterial metabolites, such as the short-chain fatty acid butyrate, that shows that it's so important to have that early bacterial cross-feeding that happens in the gut of a newborn in order to correlate with bacterial networks that promote immunological tolerance and achieving metabolic equilibrium. And as you can see in the figure here with the bar chart, there is progression from the meconium assays to 12 months of significant increases in butyrate levels that are approximating that of the mother. Certainly speaking very loudly that this taxonomic profile of the infants as they age from birth to 12 months and then compared to the mothers in the increase of butyrate levels correlates with positive bacterial networks that transition the gut microbiome from that infant profile to an adult-like intestinal microbiota that is associated with resilience and reducing the risk of developing later life chronic diseases such as type 2 diabetes, chronic disease, cardiovascular disease. Now, when we look at aging and immunity and how it can accelerate COVID-19, because we would, in this brief time of this presentation, I'd like to connect it to COVID-19. And what are the signs of aging? And I think that if you've heard me lecture before this time, I've spoken about the loss of skeletal muscle mass with its consequent frailty as being the #1 marker of aging, but also the dysregulation and decline of the immune system leading to immunosenescence. It's very, very clear that the longer one lives, the more one loses. It's inevitable. The elderly are more susceptible to various infections due to immunological changes that occur during the aging process. And as you can see here on the blue triangle, naive lymphocyte production, lymphocyte repertoire diversity are in decline, effector cell functionality, lymphocyte proliferation, and other things such as post-vaccination antibody titers. Whereas on the red triangle, terminally differentiated memory lymphocytes are increased, dysregulated cytokine production is increased, lymph node fibrosis is increased, and that most important thing, susceptibility to infectious diseases is increased. So collectively, what we have is age-related dysregulation and decline of the immune system that presents an individual with immunosenescence, and the age-related dysregulation and decline of the immune system happens for both innate and cellular immunity. And this is what is immunosenescence. Certainly, the gut intestinal microbiome is also intimately linked. The structure of the human intestinal microbiome across the life cycle in this graphic shows how there is significant increases from a highly variable intestinal microbiome at birth to high diversity in midlife, and then the loss of microbiome diversity and variability as we increase towards our older age groups. And certainly this is associated with significant frailty and increase in risk in developing chronic diseases. Certainly, we have looked at and reviewed the literature with respect to immune cells and tissues associated with immunity and their correlation to intestinal tissue, such as enterocytes and goblet cells, and the association of numerous main organs that are intimately connected to the bacterial profile in the gastrointestinal tract that tends to provide in the healthy individual a state of harmony where the host is living in a state of equilibrium, and it's this equilibrium that then tends to be associated with the development of intestinal dysbiosis. This is disrupted gut homeostasis. And there are a number of factors that increase the risk of intestinal dysbiosis. And in this partial figure of a mucosal tissue that is associated with immune activation with the risk factors such as the use of illicit drugs, the use of pharmaceutical medications, imprudent dietary practices, the ill management of stress, as Tamara has already alluded to, a very, very important factor in maintaining gut function, the lack of physical activity and poor practices of sleeping patterns tend to significantly increase the risk of systemic inflammation that then adversely affects end organs such as the liver, skeletal muscle, and the cardiovascular system, putting people significantly at risk in altering adversely the inflammatory tone of the gut. And intestinal microbiome dysbiosis is very much defined as a reduction in microbial diversity, as well as an imbalance between those that are the beneficial microbes that we carry with us in our favor and the pathogenic microbial populations that also exist in the gut. Certainly, where are we with COVID-19? What is it? Well, the World Health Organization defines it as coronaviruses. Coronaviruses are a large family of viruses that cause respiratory infections, and this disease is spread worldwide. It is a pandemic, as more than 200 million people have been infected, and on the latest figures, 4.5 million people have succumbed to the disease. And COVID-19 is an infectious disease that's caused by a newly identified coronavirus. The viral agent is designated as severe acute respiratory syndrome coronavirus 2. And with this information, I'd like to show you how it can be intimately linked to the gut. SARS-CoV-2 infected patients can present with mild symptoms or be asymptomatic, whereas severe infections can certainly be very fatal. Now, what we have recently, we were recently invited by the Reviews in Medical Virology to review the data on microbial metabolites that could mediate the effects of risk factors for COVID-19. And in this particular presentation, we showed that the respiratory viral entry and through its circulation can also be associated with intestinal dissemination. The common respiratory symptoms that are observed in clinical practice are fever, dry cough, fatigue, breathing problems, with additional manifestations such as the production of phlegm and headaches and the coughing up of blood. Viral entry and dissemination and damage to various organs can very much ensue. Certainly what we have found is that there is a lung-gut axis. There are significant connectors with gut blood cells and mucosal tissue in the gut that connects directly to the lungs. The intestinal microbiota produces signals through the systemic circulation and through modulators of the microbiota that could be probiotics, and we'll talk a little bit about this later. Certainly diet, physical activity, perhaps the administration of vitamin D3 that could actually help in modulating and tempering down the adverse effects of viral infections in the gut. Certainly what we find is that today, numerous publications tend to show that we should not be neglecting the gastrointestinal tract. And there are two main aspects of concern here that causes severe respiratory disease, and that there is a significant relationship to gastrointestinal symptoms and their influence on the cause of the disease. Gastrointestinal symptoms in the context of COVID-19 include loss of appetite, there's nausea, vomiting, the development of diarrhea and abdominal pain, and also the excretion of the virus. And it is important that this produces a significant link for us to further understand how the microbial community in the intestines is directly affected by severe by a severity of the SARS-CoV-2 virus, and that the virus-mediated gut microbiome dysbiosis, disequilibrium may cause severe secondary infections in coronavirus diseases of susceptible patients. There is a potential connection between the gut microbiome dysbiosis and COVID-19 severity that has been recently established. And in this context, studies have found that SARS-CoV-2 infection may disrupt significantly the microbial populations that are present in the gut that may then add to severity of the disease. Certainly, when we look at our studies and we look at the scientific literature, there is a significant proportion of patients diagnosed with COVID-19 that present with gastrointestinal complications, along with the loss of commensal intestinal microbiomes. This is frequently observed in numerous studies in numerous geographical areas. Also, there's reported that COVID-19 patients treated with broad-spectrum antibiotics have a significant increase in risk in secondary infections by multi-drug resistant bacteria. And this is a concern with almost a twofold higher mortality from septic shock. We've also looked in a review article on how numerous approaches have been studied to improve the gut microbiota in COVID-19, which includes probiotics, bacterial metabolites, and prebiotics, as well as nutraceuticals and other elements. And at this stage, I think that I would like to say that probiotics and prebiotics they're not a panacea to fix all chronic diseases. They're a functional medicine. They're an addendum and an adjunct that can be used to improve gut dysbiosis. So far, and you can check on the clinicaltrials.gov website, there are 19 clinical trials around the world testing the efficacy and investigating formulations in COVID-19 symptom severity, prevention, and treatment that are looking at various compositions of probiotics. However, there are no firm conclusions as yet. It can be advanced, though, to clinical practice, but there is a plausible clinical idea that good probiotic and symbiotic formulations, those that include a prebiotic, may be useful in helping to reduce the severity of symptoms of those patients with COVID-19. In a more recent review, we've proposed that immune responses to SARS-CoV-2 vaccines can elicit protection immune responses benefit by improving the intestinal dysbiosis that leads to better vaccine efficacy, reducing the adverse effects of COVID-19 vaccines that may ensue, and also how modulation of the gut microbiota by these functional foods could improve vaccine immunization efficacy, not only in the short term, but in the long term. It's important to really understand how the highlights of our recent review article that looks at the intestinal microbiota abundance and diversity, enhancing COVID-19 vaccination efficacy, is very much pointing the finger at symbiotics, combinations that produce high levels of butyrate, a significant short-chain fatty acid produced by the commensal bacteria that may help COVID-19 vaccine efficacy and further safety. It's important to really understand what is it about the commensal bacterial metabolites that make them so special. Well, intestinal bacteria produce various metabolites to mediate health benefits. These metabolites, and there are numerous of them, and I really don't have time to go into all of them, but one of the areas that we work in my lab is to include short-chain fatty acids, bile acid derivatives, and amino acids, but looking at also at butyrate, a short-chain fatty acid that's been extensively studied as a mediator of beneficial effects by commensal bacteria. It improves intestinal barrier permeability, increases mucus turnover, restores mucosal pro and anti-inflammatory activity equilibrium, and it is a cross-feeding reaction between a number of bacterial groups in the gut that adds to the health of an individual. Certainly, when we've looked at altered bacterial metabolites, butyrate could increase immune responses to protect hosts from COVID-19 infection. Butyrate has direct antiviral effects through increased secretion of mucins and antimicrobial peptide defensins. And these are very, very clear clinical posits. There are bidirectional interactions between vitamin D3 and the gut microbiome in terms of significantly influencing the abundance and diversity of the intestinal microbiota, because not only do we have commensal bacteria producing butyrate, but the connection to vitamin D3 in a recent study that showed that its administration increased the abundance of very important groups of bacteria in a dose-dependent manner, may be a trilogy that may be significant for clinical practice to discuss with their patients in terms of administering vitamin D3 and adjunctive medicines such as probiotics and symbiotics to improve, I guess, or down regulate the severity of COVID-19 disease. Certainly this particular study, recently published in Inflammopharmacology, shows and highlights the increase in evidence that low vitamin D status is very much a risk factor for COVID-19 disease with poor outcomes. Certainly the lockdown orders could inadvertently increase hypovitaminosis, low levels of vitamin D in the general population, and those already at risk, such as the elderly, obese, and disabled, could be significantly further disadvantaged. So there is ample discussion here to actually supplement with vitamin D. Put the points to note: vitamin D is very much a fat-soluble vitamin. It has overall immunity function. Overall, it has a strong effect on the immune system. It is reported that D3 insufficiency has a strong association with increased susceptibility to acute respiratory tract infections, such as influenza, tuberculosis, and bacterial vaginitis, and numerous others. D3 has been shown to decrease the risk of respiratory infections as well as possibly the severity of respiratory infections. what we have seen in recent times in this meta-analysis and systematic review of vitamin D3 is that, and I just want to explain a little bit about the figure that you're seeing here. If you see this is a systematic review based on numerous clinical trials, randomized clinical trials, and the figure in the middle with the squares shows that things that are on the right side, the squares that are on the right side of the vertical line, shows that there's an increase in risk with infections with vitamin D. But on the left side of the vertical line, the results from the clinical trials show that vitamin D was protective from respiratory infections, and that when you look at the bottom part of the overall effect of all these clinical trials put together is that there was a significant effect of protection from D3 supplementation to prevent acute respiratory tract infections. So certainly this systematic review and meta-analysis tend to support the administration of vitamin D. What I wanted to show is one of the important things that's going on in the gut as we age is that we're losing a major player in the gut, and that's bifidobacteria, which is very high in newborns and children. And as we age and we become more frail, we're losing this bacterial group that is a significant cross-feeder, producing another short-chain fatty acid, which is acetate, that feeds the butyrate producers, which significantly interact with mucosal immune function. So you can see how the deterioration of the immune system and in the frail and the well-recognized age-related chronic diseases that emerge could have a significant association with the loss of this very important group of bacteria. Certainly, as the literature reports, read the intestine and the lung axis. On the left-hand side, you've got a balanced gut. On the right side, you've got an unbalanced gut. And from asymptomatic to moderate COVID-19 to severe to fatal COVID-19, I think that the importance is vaccination. And in summary, for better health outcomes in the time of COVID-19, one has to eat a little better, exercise regularly, certainly, as Tamara has said, relax and meditate and smile often. It only takes 17 muscles to smile and about 43 to frown. Talk with your family doctor about functional medicines that work, and consider a vaccine for enhanced health outcome. It certainly is of significant importance. And I thank you for your attention.
Thank you, Luis, for a very detailed and informative session. So we just have a few minutes left for questions. But first of all, obviously, thank you, Luis, for that presentation again. And we've had a number of questions that have come through that I've got a short list of here. So we might just make a bit of progress and see how we go up until 7 o'clock. One of them, Luis, is, I mean, you might have kind of covered this, but how do we improve our gut health, our gut microbia for adults and also for young children?
Well, look, as I said in the presentation, there are a number of factors that tend to disrupt the intestinal microbiome, but I think that it's very, very simple. Prudent dietary practices, a balanced diet, some physical activity, some management of stress, and I know that in these times it's so difficult, and perhaps talk to your doctor about what good multibiotic and prebiotic formulations that can help, because these are not supplements. These are adjunctive medicines. They're functional foods, and as I've said, these are not a panacea to fix everything, but they are adjunctive functional medicines and should be treated as such. And the bottom line on this is that with physical activity, when you eat a little bit better and you focus on lowering the level of mental stresses with these functional medicines, you could do very, very well.
Absolutely. Tamara, how do you think we monitor our immune health? You know, what are the things that we can do to do that? And you've talked about a number of things in your talk, but perhaps some of the key things that might say, how do we know how we're tracking?
Yeah, so from a clinical perspective, obviously not falling sick. So depending on where you are in that life cycle, as Luis showed, if you're a child, if you're an infant, you need to be exposed to different sorts of pathogens and build up your immunity. But as immunity becomes more advanced and more developed, the fact that you're often not falling sick, or if you do fall sick, that you're able to get well pretty quickly, that's a good clinical indicator that your immune health is working well. In those of us that suffer from chronic and complex illness, certainly good markers are if you're not having acute flares. So if you have Crohn's disease, for example, you're not getting acute recurrent flares of the Crohn's or rheumatoid arthritis or fibromyalgia or chronic depression. All of these are good markers that any individual can monitor for themselves that their immune system is functioning well. And then on the other hand, obviously not developing complications and not developing autoimmune conditions. So when you've got that hyperactive immune response compared to the underactive immune response. So they're fantastic markers that everybody can track for themselves. And then coming to a doctor, obviously, simple things like blood pressure, cardiovascular health, blood tests, further diving in can be done.
Thank you. Luis, what are the uses and the benefits of pro and prebiotics? And some of our listeners might want to know a little bit of the difference between those.
Well, probiotics are the bacteria in the formulation, and prebiotics is usually a fiber of some sort that is a beneficial food for the intestinal bacteria. I think that up front, I've got to say this, and I have to reiterate it, these will not cure COVID-19. They are an adjunctive medicine to maintain the intestinal microbiome in an optimal balance in the gastrointestinal tract, which will benefit immunity. And when this happens, immunity is enhanced, gut function is good, and this provides an overall health benefit, even in the time of COVID. And then if you add the prescription of a COVID vaccine, you are now well on the way of doing very, very well for your health.
Thank you. Tamara, so what would be your sort of recommendations in terms of, say, particular foods that will heal or help your immunity?
So I think key to that is avoiding things that are going to cause problems with your immunity. So high sugar foods, alcohol, saturated fats, all those sorts of foods that create this pro-inflammatory state. And then, as discussed, the other foods are ones that feed your microbiome, but also provide you with the nutrients and the minerals for good cellular function. So a diverse diet in terms of vegetables that cover various vitamin groups. So the good marker of that is different colored vegetables. Not a food, but definitely a supplement, vitamin D. And as Professor Saleh says, vitamin C is so important for good function. So making sure you have adequate vitamin C in your diet and healthy fats. So those good omegas, I would highly recommend, and also adequate iron, zinc from meat for the iron, or shellfish for zinc, selenium, Brazil nuts. There's a whole variety. And I highly recommend, individuals seek help from a dietitian or a medical practitioner, nutritionist, to get specific advice.
And just on that, Luis, you talked very much about vitamin D and its benefits in terms of that respiratory health. And Tamara's touched there also on vitamin C, but what would you talk about in terms of other supplements that would be of benefit, particularly in the current environment?
Yeah. Well, look, Amanda, it's certainly a fact that viral infections, conditions such as obesity and diabetes, can adversely affect the body's nutrient status. There's no doubt about that, okay? And this can lead to depleted levels. And as Tamara says, it's prudent to be supplementing with these minerals and vitamins, and also as part of a balanced diet, including that as part of a balanced diet. But I think that from the literature and the work that we do, adding an additional protection with vitamin D3 could help safeguard against those afflicted with the mild form of the infection. Certainly, if they have a severe form of the infection, well, then that's a quick trip to the ER where colleagues are very well prepared to look after these people and help them not progress to the ICU. So certainly that's the way I think I see this.
And I think, Tamara, sometimes people worry if I take lots of supplements, what's really the impact on my liver? I wonder if you can talk a bit about that.
Yeah, so I think with regards to the liver, there was some recent publicity around black cohosh and a rare complication happening around people's liver function and hepatotoxicity. So certainly supplements, aren't without, consequences, and these are an adjunct, so they're not completely benign. So careful monitoring because adverse side effects can happen. But the other major issue around supplement use is taking too many supplements, taking multiple combinations and not realizing that potentially levels could be too high. So I think, as with everything, careful monitoring, looking for any obvious side effects to your health, and checking with your health practitioner, taking your whole bag of supplements in so that somebody can review what you're taking and making sure that it's safe and doing the right work that you want it to do for you.
Thank you. And that's right. It's really getting the right advice and the right dosage, etc., is obviously critical. We're almost out of time, but our last question this evening, I'll just ask Luis. So you've talked about having the vaccine. Obviously, there's a big push for us to be vaccinated. What do you think we can do to minimize the side effects? And then if we are feeling unwell after we've had the vaccine, what do you think that we might do to sort of promote our recovery?
That's very much an individual thing. I think that promoting good gut health can help. This follows a recipe of prudent nutritional practices, some physical activity, managing your stress. I think that, if I can say something very, very clearly, the result of vaccinations and the infinitesimal risk of a side effect beats by a country mile the severity of infections that can lead to a fatal outcome. And I know that there is a lot of talk that goes around about that people could have significant adverse effects due to the vaccines. I don't think, from my point of view, it's not mandatory. It shouldn't be a mandatory thing, but it should be an education thing that GPs and possibly even pharmacists could discuss this with their patients, allay their fears, and then present to the community the enormous benefits of being vaccinated, and then linking that to improved intestinal health that can then minimize additional adverse events that could ensue post a vaccination.
Thank you. That's all we've got time for this evening in terms of our questions. So thank you to everyone who sent in numerous questions, and apologies for the ones that we weren't able to get to this evening. Thank you again to our speakers. Tamara, always a pleasure to have you here. And for Luis, thank you so much for your time.
Pleasure.
And your the time that you've both taken to put those presentations together. Certainly at NIIM, we want to support your health, and if you need any advice or support, please get in contact with us. And just another plug that follow us on Instagram, LinkedIn, Facebook. There's always lots of resources coming out there that is worthwhile and will be helpful. And finally, if you haven't become a Friends of NIIM, then go to our website and sign up, and you'll receive regular updates and links to our webinars. So thank you again to our presenters, and have a good evening. Bye-bye.
Thank you. Bye. Bye.